All right, go ahead, Alicia.
Good morning, everyone. We're very happy to be seeing you and to be with you. I think welcome to this webinar. It is a webinar that is jointly organized with the Instituto Familiar de la Raza and other community-based organizations and by the UCSF Latinx Center of Excellence. I'm Alicia Fernandez. I direct the UCSF Latinx Center of Excellence. I'm a doctor, and I'll introduce myself some more later. But perhaps, Alana, we can go over the logistics first.
Great, thank you so much, Alicia. My name is Alana Peffinger, and I direct strategic initiatives for the UCSF Latinx Center of Excellence. I just wanted to go over a few webinar logistics. So as we mentioned, everybody is in listen-only mode. If you do have a question, we want to direct you to the question pane to go ahead and input your questions. We'll be moderating that box, or monitoring that box rather, throughout the presentation. And just so you all know, this webinar is being recorded and will be posted on the LCE website with the link down below. With that, I'll go ahead and send it back to Alicia with information on the format for today's webinar.
Great. So what we wanted to do was really give you all who are staff in our community-based organizations a chance to ask your questions. We realize that you are trusted intermediaries, that you know the community, you're part of the community, you have long time been active advocates for the community. So we want to make sure that you got your questions about coronavirus, COVID-19 answered, so that you felt comfortable with the information that you were sharing with the community. So what we've done is put together a few speakers that we will all speak very briefly. And we hope that the bulk of this session will be a question and answer session. It's a little difficult. I understand that we have over 60 people on this webinar. And I know that it's difficult to conduct these, but as Alana has pointed out, even though we won't be able to open the mic so that all 60 of us can talk at once, we will be hearing your questions through the chat box, and the bulk of this should be question and answers. If we don't get to your question, we'll try to follow up with you after the webinar. Next slide. So today's presenters include Dr. Angela Gallegos Castillos. She is a community builder, and she is a co-chair of the San Francisco LPEC, and I'll let her say some more about that in her own slides. You see my face there, I'm Alicia Fernandez. I'm a professor of medicine at UCSF. I'm a researcher on health disparities, but maybe most importantly for this morning, I am a long time, over 18 years, I've been a doctor at San Francisco General Hospital, where I take care of patients both on the inpatient side when they're admitted to the medicine, and also for a long time in the primary care clinic, in the 1M clinic. So I'll be answering questions from that perspective. We will they'll also hear from Dr. Amy Beck. She is also a professor, an assistant professor at UCSF in pediatrics, but she's also a longtime doctor at San Francisco General, where she practices general pediatrics and also runs a pediatric obesity clinic. And very happy to also have with us Dr. Adriana Aguilera. Dr. Aguilera is an associate professor at Berkeley School of Social Welfare. He is also a professor with UCSF Department of Psychiatry, and he is a clinical psychologist and practices at San Francisco General with Spanish-speaking patients. All of us see primarily Spanish-speaking patients, and we'll be talking from that perspective. So let me just turn it over to you, Dr. Angela Gallegos Castillo.
Hi, good morning, everybody, and welcome to this webinar, very important webinar for our gente, our Latinx community. I am, as I mentioned, Angela Gallegos Castillo, and I work with Instituto Familiar de la Raza. And I also am co-chair of the San Francisco Latino Equity and Parity Coalition, which is a coalition in San Francisco aimed at increasing investments to improve the quality of life for Latinos, Chicano, Latino, Indígena community. I'm representing Dr. Estela Garcia today. She is Executive Director of Instituto Familiar de la Raza. And we wanted to share out a little bit about the organization and its collaborative spirit in relation to addressing Latinx community needs. Next slide. Many that are on the call are from San Francisco, hopefully, and you all know that the Instituto began in 1978 really to begin to serve the unmet mental health needs of the Latinx community. It's an anchor organization of over 40 years, and we serve over 6,000 low-income immigrant mixed status families. We have a variety of programs, La Cultura Cura, Si a la Vida, and we address multiple community health issues from HIV/AIDS prevention to criminal justice reform, clinical services, family support. So it is a multi-service agency. And the beauty, I believe, and I believe the reason why it's so successful is that Instituto has from the beginning, its inception, adopted an integrated approach to healing, you know, how it is that we work culturally with our communities to address trauma, and we utilize a traditional complementary as well as different types of modalities to support the healing of the Latino community. We believe that cultura is a very integral part in addressing cultura, working with cultura and understanding the resiliency that cultura brings in supporting the healing and recovery and wellness of our community. Next slide. So Instituto defines itself as a healing institution. What does it mean to be a healing institution is that we really do take into consideration the context by which we live as Latinos. And our healing modalities are rooted in the historical and cultural traditions of our gente, because the idea is that we believe that our cultura, with all the regalos y cargas that it has, that we do have inherent resources to heal ourselves, to create connection. We integrate cultural values, celebrations, and the organization, as well as the institutions that we work with in San Francisco and the other Latino serving organizations, understand the importance of working with the assets and the strength of our gente. The pilares of the Instituto, and we are seeing this experience of the coronavirus and the pandemic across the world is really a reflection of how we understand our life experience to be, which is interdependent of each one another. And Lakech literally means we are one, that there is a connection and interdependence of how we are living as human beings, and it recognizes that individuality and separateness is an illusion. So never more are we experiencing this idea that, you know, we are interdependent, that what one does in one part of the world is impacting another part of the world. And, you know, I hope this is a moment where people really truly understand that. Cultura Cura and Si Se Puede are two other pillars of our organization. I spoke a little bit about the resiliency of our gente and the inherent resources that we believe everyone brings to their own healing and community building. And Si Se Puede, another pillar of our organization, really reflects the time in which Instituto was born, which was during the 70s social movements and the Chicano movement. that really focused on self-determination, dignity, and respect. And I believe our participation here, working with UCSF and the Latino Centers of Excellence, is creating those bridges, doing that community building so that we can offer resources, information, and knowledge for our broader Latino community, Latinx community, so we're better informed as organizations and as staffers to support the community that right now is in very high need. So I think that's probably all I want to say. Instituto has, from the beginning, had a collaborative spirit, and so it's important as we move forward to continue our collaborative sharing, to continue our strengthening our relationships, and figuring out together how best to serve our Latinx community through these community-based solutions. So thank you for participating, and I'll be here at the end if anyone has questions.
Can you see my slides?
Yes.
Great. I'm going to go fairly quickly through this, and then in order to get for the question and answers. So if there's something that folks don't understand, happy to come back to it or try to be more clear when I explain it. As you can see, this is the curve of cases in San Francisco. We are still going up. We're not going up dramatically. But one of the points that I want to make is that it is very difficult to know what is happening by following case numbers, because case numbers really reflect testing, how much testing you're doing. And the testing that we're doing in San Francisco, and actually in California as a whole, is still very limited. It may be more helpful to follow hospitalization. And San Francisco, to my knowledge, is not publicizing the number of hospitalizations. But if you follow on Twitter, Dr. Bob Wachter, who is the chair of the Department of Medicine at UCSF, every evening he is posting the tweeting about his views on the pandemic, and specifically, he tweets out the number of hospitalizations at UCSF Health, and he will also allude to the number of hospitalizations at San Francisco General Hospital. The other option is, of course, to follow deaths. And fortunately, there have been few deaths in San Francisco, but that also gives us a sense of how many people might be ill or what may be happening. The number that I am following personally most closely is the hospitalization number. And let me just say that the hospitalization numbers are very good. UCSF Health, I think, is posting 12 folks hospitalized. I don't know the exact number at San Francisco General, but it is certainly under 20. And these numbers are extremely low. We are nowhere near capacity anywhere in the city. We have lots and lots and lots of capacity. And it looks very encouraging that even though we do have cases, and those numbers may go up more as we test more, we appear to be getting cases slowly enough that the healthcare system has more than enough capacity to cope with those cases. So the overall news from San Francisco at this point is, at least in my view, very good. That said, I do think that there is a Latinx outbreak in San Francisco. Now, I have not seen comprehensive data, so that is a big, big caveat. But San Francisco DPH has spoken with many of you on this call, many of the CBOs, and I can tell you from our own experience working in one of the outpatient clinics located at the hospitals that we have a way over representation of Latinos in the outbreak. To give you an example of 10 COVID patients that we had that we're following as outpatients in our clinic, 10 out of 10 are Latinos, 9 out of 10 are monolingual Spanish speakers. Moreover, among our patients, and this is, these do not appear to be family clusters. It's not like it's, say, 2 families, each with 5 members. These are all appear to be different. In my view, even though I have not seen the comprehensive data, and we need to see that from the San Francisco DPH, both San Francisco DPH and our center believe that there is overrepresentation of Latinos among the cases that we're seeing in this part of the city, and most importantly, coronavirus is clearly circulating in our community. I don't need to tell you that this poses tremendous challenges because of the twin issues of COVID and inequality. Many people live in very small spaces. Many folks are still needing to go to work in restaurants as janitors, as domestic workers, and all sorts of work. Folks need to use public transportation. There's a great difficulty with isolation when people are in small quarters. People are coming out to join the food lines and are participating in the school distribution of food lines. That is a great thing, but nonetheless, people have to leave their houses to do that. And then finally, as you know, there may be fear of testing and seeking care among folks who are undocumented and who may not have heard that testing is free and will not be subject to public charge. The main message that we now want to share with, and we would like you to share with the Latinx community, is that if you have symptoms, you can and should get tested. There's different ways of getting tested. You can call your own doctor. You can call, and if you don't have a doctor, you can call 311. At 311, they can make you an appointment for a test at Castro Mission or at the Southeast Health Center, and as of today, on the old parking lot at San Francisco General. If you don't want to call 311, or you're not just sure what to do, or you think the person's not going to be able to do that, one main message is that they're welcome. They're always welcome to walk in to the San Francisco General Urgent Care Center, which is located in the old hospital emergency room. There are plenty of people there, obviously, who are Spanish speaking and will help people get tested. And again, testing is free and is not subject to public charge. Why are we urging that people get tested? So that DPH can offer people isolation rooms. The city has isolation rooms available in hotels so that people who cannot safely be isolated at home can be isolated there. Also, so that people can take more precautions and be more careful as they try to isolate at home. And then we will monitor people, which is important because people can do pretty well with the disease, but a few people who are doing well at home can get sick very suddenly. So just to review the clinical information, the incubation period is 2 to 14 days. We think the average is around day 5. You all know that that the virus is mainly isolated from the respiratory tract, though we have also found it in stool and blood. People are most at risk. The people who are most at risk for severe disease are people who are people by age, and I have another slide on that. And as you also know, that asymptomatic people can spread disease, and people can spread disease, particularly in the 2 days before they become symptomatic. That said, coronavirus is in general, COVID-19 is in general a mild disease. 80% of cases are not severe. 20% of cases are severe, and of those and require hospitalization. And of those both, about 5% seem to be requiring ICU. The death rate really varies by age, with older age being more than 4 or 5 times as likely unfortunately, to have very severe disease and die. The symptoms you see here are fever, cough, shortness of breath, or myalgias, which means a body ache. But the truth of the matter is, among my own patients, a lot of people have presented just with weakness, abdominal pain, and nausea and vomiting. Here are the risk factors for severe COVID: age, immunosuppression, including HIV, some cancers, and advanced kidney disease, chronic diseases, including two that are very common in our community: hypertension and diabetes, and then medications that suppress the immune system, such as medicines that people take for rheumatologic diseases like lupus or rheumatoid arthritis, or people who need to be on prednisone for one reason or another. How social distancing works, you've all seen this meme. You stop the fire by breaking it, and that's why we're telling everyone, quédate en casa, stay at home, wash your hands. Understand that physical distancing includes family. So just because you love your sister and her kids, and they live a few blocks from you and they're family, the fact that they're family doesn't mean that you should go over to see them. Physical distancing means distancing from everyone that you don't live with. Again, we're reiterating the testing and a real focus on protecting vulnerable family members, especially older people. Frank, and this brings us to an issue that I'm not sure people really understand, or that many members of our community understand, that our kids may unfortunately be a particular threat to our older people, vulnerable people, because, and Dr. Beck will talk about this, kids can look well and be well and still shed virus. So with that, I'm going to turn it over to Dr. Beck. Alana, should I still advance the slides, or do you do that? Hello?
Oh, should I go ahead or?
Yes, please go ahead.
Okay, I'm not able to see my slides. Are they displayed or?
I'll advance them for you. Just say advance slide.
Okay, I'm seeing your slide though right now.
You are?
Yeah, I'm not seeing mine. There we go. Okay. Hi, good morning, everyone. Thank you for joining. My name is Amy Beck. I'm a pediatrician at UCSF and San Francisco General. I mostly do outpatient pediatrics, so I work in the clinic. And I'm going to try to keep my comments very brief. I think Alicia covered a lot of the important points about the epidemic, and I'll just try to touch on a few points that are specific to children. Next slide. So as the question, question comes up, how does COVID-19 affect children? Can children get ill from this? And absolutely, children can be infected by the virus that causes COVID-19. The most common symptoms that are seen in children are fever, cough, and sore throat. There are some less common symptoms, so they may have vomiting and diarrhea, may have runny nose, may have some fatigue. And most children who are infected will have very mild symptoms and will be able to be managed at home, will not even require a visit to a healthcare provider. And as Alicia mentioned, certainly children and adults can be infected and can be asymptomatic. We don't know as much as we would like to know about how risky it is. If a child is infected, how likely are they, with no symptoms, how likely are they to spread the virus? But most likely, to a certain degree, they are able to spread the virus even when they're not showing any symptoms at all, feeling completely normal. Next slide. So another question that comes up is whether children can become seriously ill. And yes, but it is rare. So a very small percentage of children with this disease will require hospitalization. And an even smaller percentage of children will require intensive care. And I'm not sharing specific numbers because the occurrence of this happening is so infrequent that it's really hard to say at this point what the numbers are. But we do know that, at least from the data that is coming out of China, and even a small smidgen of data from the United States, that children with underlying medical conditions are more vulnerable to becoming seriously ill. So diseases, any disease that might suppress their immune system, those children are somewhat more vulnerable. Okay. Next slide. So how can parents protect children? I think this has been said already, but encouraging parents to keep children at home if possible, and really trying to avoid public settings such as stores and laundromats. However, it is okay, and in fact encouraged, for children to go outside for a walk or a run each day, as long as they can maintain the social distancing, so trying to not come into contact with others who are not part of their immediate household. Of course, just like everyone else, they should wash hands. A major problem with children is actually just that they usually don't have the maturity to have good hygiene. So even if they're not getting sick, they could potentially be vectors just because they're not very good at washing their hands thoroughly. So it's really probably helpful if parents or another adult or even an older sibling can assist and supervise. Certainly, if anyone has symptoms of any sort, recommended to avoid sharing utensils, plates, cups, towels, bed linens. And then you've probably also heard this information before, but we are recommending that people wipe down the frequently touched surfaces, so doorknobs, tabletops, toilets, counters. For kids, that would also include toys that they're playing with, tablets, phones, etc. At least once a day. And if it's possible to keep windows open for ventilation, this is assuming that there's no risk of children falling out of windows, then that may be helpful as well. Okay. Next slide. Okay, so what should parents do if a child has symptoms? We strongly recommend that they call their doctor or medical provider for advice. And when we get these calls, we take a lot of different factors into consideration when determining if the child should come in. So it's really hard to give blanket advice, and those factors include the age of the child, whether their vaccines are up to date, how long they've been sick for, exactly what symptoms they have, and exactly their underlying illnesses, what medications they take, etc. And in the vast majority of cases, we do recommend that children stay home, but each situation is different. And so I really think that for kids at this point, it needs to be a very tailored conversation. And we are also taking into account, in thinking about all of this, not just the child, but the family unit, whether there are other at-risk family members at home, if they're living in any sort of group setting, homeless shelter, etc. And these kind of recommendations and algorithms are changing really, really fast. So anything I present today probably would be out of date tomorrow. So if possible, we really want people to call. And we're happy to talk to people at any point. Okay, next slide. Okay, so another thing that comes up is how can parents talk to young children? Particularly children under the age of 8. This can be very distressing, confusing. Just some general principles that you could share with families. Always recommend using calm and reassuring language, letting children know that the adults in their lives are going to take care of them and keep them safe. It's good to be truthful. We don't recommend lying, but you can always let the child lead the discussion. So we recommend really only answer what they ask. So if they don't bring up something, then they're not wondering about it or worrying about it. So just really starting by trying to check in with them and say, oh, well, what have you heard? What are you thinking? What are you worried about? For young children, I really recommend restricting access to news on television and internet. There's this kind of re-traumatization that can happen every time they see a scary report, and they are not able to process that information. So it's really better if parents or other adults in the home are kind of the filters for young children. And then another thing that's helpful is to give kids something to do so they feel empowered. And there are things that they can do, of course. They can wash their hands, they can stay home, they can do things for their own health. So that would be getting enough sleep, trying to eat healthy food. Another thing is just empowering them that they can support their friends and family and older relatives who are not living with them by calling them on the phone, or if they have access to video chatting, so that they feel like they are kind of part of the solution. Okay, Next slide. And this was just a resource to share. This is basically like a comic coloring book that a child psychologist developed, and it's available in English and Spanish for talking about COVID-19 with children. I like the fact that it asks children if they've heard of it. It asks them how to pick an emotion of how they feel when they hear the word. I like that it asks them to draw their feelings, kind of gives them an opportunity to express what they're feeling in a way that is developmentally appropriate. Next slide. Yeah, and then it just has some basic information that's, you know, at a level that very young children can understand. Next slide. Yeah, I think this last, puedes estar tranquilo, los adultos que te cuidan te mantendrán seguro, is probably, you know, the most important message for children, particularly the really little ones. So, oh, next slide. And then I think obviously a huge challenge that parents are dealing with is having children out of school, out of their normal daily routines. They're not able to interact with their teachers, their classmates, not participating in activities. And this is extremely difficult for people. So I think just starting by recognizing that, helping families to establish a daily schedule of activities, writing it down and posting it up in the home if possible with younger children, probably using some pictures to help them understand what the schedule is, just to sort of mimic somewhat of what would happen in a school environment. Trying to include breaks for movement, whether it's dancing, walks outside if they're able to. There are a lot of YouTube exercise videos for kids that can be fun and can get them moving. And then I think, even though it seems weird to say including time together as a family, because people may be together more than they ever were before, but trying to have a time that they are together without distractions from television or phones is probably just to have a touch point every day where the kids can kind of check in with the parents and parents can check in with kids about how they're doing. And then, as I mentioned before, really trying to actually put into the schedule a phone call if possible, or a video chat, so that kids still feel connected to everyone that they are apart from right now. Okay, next slide.
I thought we could go directly to the fact that there are some resources, because we should probably move on. I'm sorry.
Oh, I'm sorry. I'm going too fast. Yeah. Okay. Yeah. And then the last slide is just some links to some fun movement and mindfulness resources for young children that have been popular. So. Thank you very
much, Dr. Beck. And we're going to move now to more on the issue of mental health with Dr. Adriana Aguilera. Adrian, I'm also going to ask you to speak briefly, just so that we can get people to the question and answer. So thank you so much.
Yeah, no problem. I only have a couple of slides. So I'm just going to talk briefly, to share a couple of tips of ways we can take care of our mental health. Obviously, the focus is on our physical health, but given the situation of sheltering in place and isolation from others, I think particularly for Latino communities where we rely on social connectedness, I think this is particularly impactful. So if you can go to the next slide, please. So I would share just a couple of principles that I think we could all benefit from, but I think if you're interacting with folks, things to remind people of are generally to share this idea of being kind to ourselves and each other during these difficult times. I don't think everyone is operating at our best necessarily. We're in very difficult circumstances. I think as parents, we're in very difficult circumstances. As those of us fortunate to have jobs, we're in difficult circumstances. If you're unemployed, everyone's under very challenging circumstances. So acknowledging this is important. I think another thing is it's easy to get caught up in the anxiety of the moment and thinking about all the negative things, trying to focus on even basic things to be grateful for. A sunny day, the quiet in the neighborhood, whatever the case may be. These are little things that can make a difference in our day. And I think, again, these are going to vary, perhaps spending time with family, etc. Another thing is finding enjoyable activities despite limitations. So oftentimes we would say, go outside, go connect with other people physically. We can't do that, but there are still things that we can do today. So maybe playing a game with somebody, connecting with loved ones virtually, as was mentioned before. So trying to find ways to adapt and do things that are still healthy for us, given these limitations that we have. So I think these are a few things to keep in mind. Next slide. So some local resources for folks that are particularly having difficult times. All these sources are bilingual, with the potential exception of your physician. The California peer-run Warm Line is available to connect with somebody else if you're having difficulty. There's always a suicide prevention line in San Francisco. There's also a 24-hour crisis for parents line. So I think parents in particular are under some real challenges. I have a 6-year-old and a 3-year-old, so I very much understand the challenges of just throwing kids into this uncertainty. There's also a parent line at USF specifically focused on parents of young children through 3 years old, dealing with changes in sleep and other challenges that poses. And also your physician. I think the physician, the physicians are overwhelmed, but they are still going to be your best connection to where you need to go. There are some limited mental health services, and we're all adapting to trying to deliver some of these things remotely. But your physician is going to be the best person to connect you. And then the last slide. So this is a time where some of my work, I do research in developing digital interventions for mental health. And I think this is one time where it's going to be very important to rely on these tools when we can't connect physically. So a few things I've highlighted that are good resources and also available in Spanish and English. A couple of apps called Headspace. One's Calm, another one is Siente. These are all in app stores, Google and iPhone. There's another one focused more on kind of what we call behavioral activation or doing pleasant activities, called Activate or Activate. Sanvelo is another app that's helpful in managing stress and anxiety. A couple of other websites, 7 Cups of Tea and Support Group Central are ways to connect with other people. So providing, getting social support. And then the last resource are meditation recordings in Spanish and English. And then the last thing is our group is working on developing a text messaging program to deal with mental health during this time of COVID. We're kind of in the process of working on that. So we'll reach out to folks in this network when we have it developed. So thank you all. Alicia, you're on mute. Oh, there you go.
Thank you to all the panelists. We are eager to hear your questions. So Julia, do you want to go ahead and give a few questions?
Sure. Can you all hear me?
Yep.
Perfect. My name is Julia Farfan. I work for the UCSF Latinx Center of Excellence. We've had some questions coming in about making these resources available. We will go ahead and send out the resources that were presented in this presentation to you all, in addition to making actually this video feed available to you if you want to review it afterwards or share it with your networks as well. One of our first questions that came in has to do with testing. If somebody could speak to how long until there will be a greater testing capacity in place, and if UCSF has enough test kits to increase that capacity.
Okay, good. I'll take that. That is Alicia Fernandez. So much more testing is becoming available in the city, and I work in the public health system, not at the UCSF health system, but both systems have really ramped up their ability to test. So I think every day that is changing, and we are getting more and more tests available. And that's why our message is, if you think you have symptoms, get tested, at least to this community, to this monolingual Spanish-speaking community. I don't think that is a message that we are putting out everywhere, because many people can talk to their doctor at home, and the testing won't really impact what they're going to do, and can safely isolate at home. The reason that we're changing this message for the Spanish-speaking community is because of the difficulties with isolation. So again, please call your doctor if you have one, and if you don't have one, you can call 311 and get a testing appointment, or you can come to San Francisco General Hospital and get a test. Next question.
Thank you. Can one of the panelists please speak to the risks for pregnant folks in second trimester? Additionally, what would you recommend for sending small children to daycares that come from families of essential healthcare workers?
Amy, do you want to take those?
Yes, I caveat that I am not an OBGYN, so I think that we know very little about the risks in pregnancy, you know, at this point. Yeah, so I think that, yeah, there's just not a lot of information. There are definitely concerns from what was seen with the SARS epidemic and MERS in terms of risks of you know, birth defects and miscarriage, but we have no idea and really no indication that that's going on with this epidemic right now. So I think it's difficult to say what overall, from what has been seen, you know, pregnant people have done well with this, and infants, there have been cases of infants who have been who have tested positive after you know, mother having the COVID-19, and those infants have done very well as well. But again, I think it's probably better for every, just like as for children, we really want to tailor what we're offering and what we're recommending. I think similarly that I would encourage pregnant women to speak to their OB about their particular risk and their particular underlying health conditions, what is going on with their pregnancy. So the question of daycare, yeah, obviously it's, you know, ideally we would not have children in daycare, but I do think that the daycares are following a lot of good practices in terms of making the daycare environment as safe as possible. So they're limiting the groups of children who can be together, kind of cohorting staff, so it's the same staff member with the children, doing a lot of increased disinfection, you know. So I think that essential workers should feel comfortable continuing to send their children to daycare. That being said, if people have another option, you know, and they're able to keep their children out of daycare, I think that is certainly a reasonable choice. But I think the Department of Public Health has been very helpful in providing very specific guidance to daycares on, if they are going to remain open, how to maximize safety.
Next question.
Great, thank you, Dr. Beck. We have a question regarding the gatherings of a large amount of Latinx folks, specifically in the Mission District. And folks are wondering what culturally appropriate resources and physical distancing strategy should we be offering the community?
I think that is, the culturally appropriate resources, I think, are for people, we have some and we will post them. And the Department of Public Health has some and we will post them. There are many, and those are posted. There are many YouTube videos about how to wash your hands and so on and so forth. In terms of encouraging people to stay at home and physically distance, we think that is done by having you all as community-based organizers, us as physicians, the media, everyone give the same message that physical distancing is extraordinarily important. If it helps for people who feel more comfortable receiving their news from Mexico or other places, Mexico launched a wonderful campaign called Susana Distancia that is a superhero character, and that people can get onto that, and it has some great videos, and people can get onto that via social media. I'm not sure if there's something else that the person was really wanting to ask, but maybe we can keep going and people can ask more specific questions if they had.
Yeah, just as a follow-up to that question, they were wondering specifically having to do with folks who are experiencing homelessness or living in those cramped conditions.
Right. Well, as I said before, our community is suffering from twin epidemics, you know, the coronavirus and poverty and inequality. And a lot of those, there are not easy solutions. However, for folks who are experiencing homelessness, the Department of Public Health is working very hard to be able to, if folks are homeless and have coronavirus, they can be isolated. The Department of Public Health has hotel rooms and is making that available for people who can be safely cared for as an outpatient. We also obviously can care for people within the hospital. For people who live in crowded conditions, again, that's why it's important to test early. If the person has COVID-19, they can be offered an isolation room in one of the hotels in San Francisco. Next question.
Our next question has to do with what would the panel suggest for advocates and working with these populations in regards to policy modifications regarding COVID-19?
Why don't I take a crack at that and then open it up and see who else? You know, it depends on what level of policy modifications. Obviously, there are so many at the federal level, but for our community, as you know, people who are undocumented, and it appears that people who are in mixed status families will not be able to access the financial relief that is coming from this CARES bill that Congress just passed, because of the need for everyone to have a Social Security number, not just a tax number. So I think there's going to need to be different solutions at the state level or at the local level. And I think that that is an area where the CBOs can take a lot of leadership and a push for policy solutions that include direct financial support for folks who are out of work, even if they are, or irrespective, let's put it that way, of their documentation status. I'm going to ask Dr. Gallegos Castillo if you can comment on this.
Sure. Yes, that's a great question, because I think right now we're experiencing a lot of gaps in the way that local government is approaching and working and pushing out information to the Latinx community. Right now, we do know that Shaman Walton, a Board of Supervisors, is working on legislation to provide funding for undocumented families. We know it's not going to be enough, though. So I think we could do well by organizing and bringing our voices together to really push the local local policy makers and the mayor to increase that fund, and to just making sure that they know that we definitely need more support. $500, I think, is the current amount per family. And I think we need to advocate for more of that.
Is there anyone else on the panel, or should we take another question? Go ahead, Julia.
Let's see. Are people with asthma or similar health challenges not identified as high risk for contracting COVID?
Yes, that's a great question, and it's my fault entirely that I left that out. Smoking is a risk factor for severe COVID. Smokers get worse COVID, and people with respiratory diseases like asthma, unfortunately, are also at higher risk. However, many children have asthma, and we are still seeing that the vast majority of children do really well. Next question.
This one has to do with the timing of vaccinations. So there are young infants who need their booster shots or just need to get a round of vaccinations. What is your recommendation during this time for them?
I'll take that one. So absolutely, we would recommend that if your healthcare provider wants you to come in to get your vaccinations, please do. We don't want to create a new public health emergency and trying to address the current public health emergency. So I think every practice and clinic is handling this a little bit differently. Currently, we are still seeing infants through 12 months for in-person visits. And then for anyone who's also not up to date, we're also still seeing them. The remainder of our well child visits, though, are being done through telemedicine. Again, this is evolving, but absolutely, if your child needs to get their vaccinations and they are 12 months of age or younger, or if your pediatrician is still recommending that they come in, I strongly recommend that you get your child vaccinated. And I think we and many clinics are taking precautions. So cohorting, meaning that, you know, having the well infants come in at different times, using different waiting rooms. There's a lot of different strategies that people are doing to make the clinic environment be as safe as possible.
Next question.
We have a few questions coming in that deal with survivors of domestic violence or those experiencing domestic violence. Have any of the panelists seen any developing trends in the hospital that deal with this? And are there any online resources to help support those that are experiencing domestic violence but are unable to escape those situations because of the stay at home?
Adrian, do you want to take that?
I think that's an area of great concern. I don't know. I think the problem is that a lot of this is uncertain. From what I've seen so far, is the organizations that are focused on domestic violence aren't seeing a lot of folks, obviously, recently. But what's going on, you know, in the darkness, if you will, is unclear. I unfortunately don't have anything concrete at this moment, but I know that there are I think that there are some resources that can be connected via call or remotely. I'll have to kind of get those, and then hopefully we can share something out.
Yeah, one of our colleagues is working on, and we will send those out. We'll send out a slide with resources at the end of this call as well.
Yeah, we also have resources that we can compile and share as well.
More questions?
Yeah, this will likely be our last question. It is 10:58, and I want to be mindful of everybody's time. We have questions coming in regarding masks. So is there a recommendation to wear a mask while going outside, for example, to get groceries? And if so, do you have any recommendations for how to find those, or what type of mask someone would need to wear outside?
Yes, thank you for that question. It's an excellent question. I believe that just last night, Governor Newsom said he thought it might be a good idea. I don't think that's an official recommendation yet. I don't know. I do think that if folks can, so this is the issue. We need the masks. We need the medical masks, the N95 masks for use within the hospital. There are other more commonly available masks called surgical masks, which are the paper masks, which people can use. But what we're really recommending, and I know that it sounds strange, is that because we don't think people will be able to find masks, we are recommending that that people can go ahead and make their own masks. And they make it with a t-shirt or with a bandana or whatever they want to make it. Your question may be, well, will that protect me? And the answer is no, because masks don't protect people. Masks don't protect the wearer. Masks protect other people. So when I wear a mask in order to protect everyone else from me. And then if you're wearing a mask, everyone is wearing a mask, then that protects me because they're wearing a mask. So do not worry that you don't have the doctor's mask, the N95 mask. That's not, those masks are fitted to us, and that's why we use them to protect us from high concentration situations. What's really seems to be emerging as very helpful is just to have almost everyone wear a regular mask, a homemade mask when they go out in order to protect each other from that. I hope that's clear. Wearing homemade masks protects people in the community if most of us do it. And I suspect that San Francisco will, in the not too distant future, move toward that, though I don't know, because this is an area of controversy. My advice to my own patients when I call them is, yes, wear a mask. If you have bought one, great, but otherwise any mask will do. Along those lines, we will have a question and answer session in Spanish that is being hosted by MEDA in the one of the mission great CBOs. It's Lo que debes saber sobre COVID-19, and it is today between 4 and 5 on Facebook. And we will be doing some of the same people will be on the panel. We'll be speaking in Spanish and trying to answer people's questions. We know there's a lot of questions out there. We thank all of you for everything you do. We thank the members and the staffs of the community-based organizations. You are the most trusted people in our communities. And we really hope that this has been helpful in getting some of the lay of the land and some of your questions answered so that you can go out and help all of us educate. I really think that in San Francisco, things are going overall very well, everything considered, but we need to stay very vigilant and we need to protect our community. So thank you all very much. And if at the invitation, well, I thank our panelists, Dr. Angela Gallego Castillos, Dr. Amy Beck, Dr. Adriana Aguilera, and I thank the staff of the Julia Farfan and Elena Pfeffinger from the Latinx Center of Excellence at UCSF. And we will be delighted to keep offering these if people want them and to partner with our community-based organizations, with the Department of Public Health to bring good information to everyone. Thank you all very much. I don't know how to turn it off.